Hey, how's it going, everyone? This is FixerMed. Welcome back to my high yield anatomy review series for the USMLE Step 1 NBME CBSE and NBME CAS examinations. This will be part 23 of my multi-part video series covering the discipline of anatomy to give you a broad overview of it for these exams. So without further ado, let's go ahead and get started on today's content. First, I'd like to open up by talking about the Douglas pouch, which is also known as the rectouterine pouch. The rectouterine pouch, also known as the pouch of Douglas, is a peritoneal space located deeper within the female pelvis, situated vertically between the rectum and the uterus. This area serves as a potential location for pelvic abscesses. Similarly, the vesicouterine pouch refers to the space between the uterus and the urinary bladder, as seen on the picture to the right. Alright, moving on to the next concept. I'd like to talk about culdocentesis next. Culdocentesis involves withdrawing fluid from the cul-de-sac of Douglas, also known as the rectouterine pouch, through needle puncture of the posterior vaginal fornix, positioned near the midline between the uterosacral ligaments. This procedure is performed because the rectouterine pouch represents the lowest part of the female peritoneal cavity where inflammatory fluid such as pelvic abscesses can accumulate. The procedure done can be seen visually on the picture to the right, where you can see culdocentesis checks for abnormal fluid in the abdominal cavity behind the uterus. Let's go ahead and move on to the next concept. Next, we are going to talk about the foregut, midgut, and hindgut. The foregut, midgut, and hindgut are distinct regions of the gastrointestinal tract with unique anatomical and innervation characteristics. The foregut includes the esophagus, stomach, duodenum, first and second parts, liver, pancreas, biliary apparatus, and gallbladder. Arterial supply is primarily from the celiac artery. Parasympathetic innervation is provided by the vagus nerves, cranial nerve 10, and sympathetic innervation involves the greater splanchnic nerves, T5 to T9. Sensory innervation is from the dorsal root ganglia at the levels T5 to T9. Referred pain is typically felt in the epigastrium region. Midgut encompasses the duodenum, the second, third, and fourth parts, the jejunum, ileum, cecum with the appendix, ascending colon, and proximal 2/3 of the transverse colon. It is supplied by the superior mesenteric artery, known as the SMA, and parasympathetic innervation is via the vagus nerves, cranial nerve 10, and sympathetic innervation involves the lesser splanchnic nerves, T10 to T11. Sensory innervation is from the dorsal root ganglia at levels T10 to T11. Referred pain is typically perceived in the umbilical region. The hindgut consists of the distal 1/3 of the transverse colon, descending colon, sigmoid colon, and rectum, anal canal above the pectinate line. It receives blood supply from the inferior mesenteric artery, known as the IMA as well. Parasympathetic innervation is via pelvic splanchnic nerves, S2 to S4, and sympathetic innervation involves the lumbar splanchnic nerves, L1 to L2. Sensory innervation is from the dorsal root ganglia at the levels L1 to L2. Referred pain is typically experienced in the hypogastrium region. Alright, now that we have covered the content for today's video, let's go ahead and move on to some questions. In the female pelvis, which peritoneal space is situated vertically between the rectum and the uterus, serving as a potential location for pelvic abscesses? Alright, pretty first order question, so I'm just going to go ahead and move on now. If you need more time, please feel free to pause the video as usual. Moving on now. The rectouterine pouch, also known as the pouch of Douglas, is positioned vertically between the rectum and the uterus within the female pelvis. This space serves as a deeper peritoneal area and is commonly associated with the potential formation of pelvic abscesses. Therefore, the correct answer is B, rectouterine pouch. Let's go ahead and see why the other answer choices are incorrect. Vesicouterine pouch. This pouch is situated between the uterus and the urinary bladder, not between the rectum and the uterus as described in the question stem. Uterovesical pouch. This pouch is located between the uterus and the urinary bladder, similar to the vesicouterine pouch, and does not fit the description of the space specified in the question. Rectovesical pouch. This pouch is found between the rectum and the urinary bladder, not between the rectum and the uterus as specified in the question stem. Uterosacral pouch. This pouch is located between the uterus and the sacrum, and it does not correspond to the space described in the question, which is between the rectum and the uterus. None of the above. While it is correct that none of the other answer choices accurately describe the rectouterine pouch, it does not provide the specific information needed to identify the correct answer. So, now that we got that question out of the way, let's go ahead and move on to the next question. Which procedure involves withdrawing fluid from the cul-de-sac of Douglas, known as the rectouterine pouch, by needle puncture of the posterior vaginal fornix near the midline between the uterosacral ligaments, primarily to address the accumulation of inflammatory fluid such as pelvic abscesses? I'm going to give you less time on this since pretty first order, but I'll still give time. All right, I think I gave you guys enough time here. Let's go ahead and see what the answer is. Culdocentesis is the correct answer. It specifically involves aspirating fluid from the cul-de-sac of Douglas using a needle puncture of the posterior vaginal fornix. This procedure is performed to address the accumulation of inflammatory fluid, including pelvic abscesses, which tend to collect in the lowest portion of the female peritoneal cavity. Therefore, the correct answer is C, culdocentesis. Pretty straightforward question. Let's go ahead and see why the other answer choices are incorrect. Hysterosalpingography. Hysterosalpingography is a radiologic procedure used to visualize the uterus and fallopian tubes by injecting a contrast medium through the cervix. It does not involve withdrawing fluid from the cul-de-sac of Douglas as described in the question. Laparoscopy. Laparoscopy is a surgical procedure that involves inserting a camera, a laparoscope, through small incisions in the abdomen to view the pelvic organs directly. While laparoscopy can be used to visualize the cul-de-sac of Douglas, it does not specifically address the aspiration of fluid from this area as in culdocentesis. Colposcopy. Colposcopy is a procedure used to examine the cervix, vagina, and vulva for abnormalities using a colposcope. It does not involve assessing the cul-de-sac of Douglas or aspirating fluid from this area. Endometrial biopsy. Endometrial biopsy is a procedure to obtain a sample of the endometrial tissue for examination. It does not involve accessing the cul-de-sac of Douglas or aspirating fluid from this area. None of the above. While none of the other answer choices accurately describe culdocentesis, this option does not provide the specific information needed to identify the correct procedure. So only one that really made sense was culdocentesis. We should be going through the rest of these procedures in the GI and reproductive review series, so it's a nice sneak peek into those. So, moving on to the next question. Which of the following characteristics correctly matches the gastrointestinal region with its respective innervation and referred pain? Pretty first order question, so I'm just going to go ahead and move on now. If you need more time, please feel free to pause the video. Otherwise, moving on now. Innervated by the vagus nerve, cranial nerve 10, referred pain in the umbilical region. This option correctly matches the foregut with its parasympathetic innervation by the vagus nerves and characteristic referred pain in the umbilical region. Therefore, the correct answer is B, foregut innervated by the vagus nerve, cranial nerve 10, referred pain in the umbilical region. This one is basically just a recall-based question. You just had to memorize the third slide to get the answer right and reason your way through why the other options are incorrect. And let's go see why the other answers are incorrect. Midgut innervated by pelvic splanchnic nerves, referred pain in the epigastrium. This choice incorrectly matches the midgut with pelvic splanchnic nerves and the referred pain in the epigastrium. The midgut is actually innervated by the vagus nerves and experiences referred pain in the umbilical region. Hindgut is innervated by the greater splanchnic nerves T5 to T9, referred pain in the hypogastrium. This option incorrectly associates the hindgut with the greater splanchnic nerves and referred pain in the hypogastrium. This hindgut is actually innervated by the lumbar splanchnic nerves and experiences referred pain in the hypogastrium. Foregut, innervated by the lesser splanchnic nerves T10 to T11, referred pain in the epigastrium. This choice incorrectly matches the foregut with the lesser splanchnic nerves and referred pain in the epigastrium. The foregut is actually innervated by the vagus nerves and experiences referred pain in the umbilical region. Midgut, innervated by lumbar splanchnic nerves, referred pain in the umbilical region. This option incorrectly associates the midgut with lumbar splanchnic nerves and referred pain in the umbilical region. The midgut is actually innervated by the vagus nerves and experiences referred pain in the umbilical region. Guys, for this question, I would just recommend memorizing this slide. Try to picture everything. I put a nice picture up, but I don't think it's enough. So what I like doing is I just like writing it out until I have it down. And when I see a question like this, I can just eliminate the answer choices I know, and then I have a pretty strong chance of getting the question correct. So it's just a nice recall-based question. You'll see some of those on NBME style questions. But that will do it all for the video today, guys. If you have any questions, comments, or concerns, please feel free to leave them in the comment section below. If you like this type of video, please be sure to leave a like and subscribe for more content like this in the future. If not, this is FixerMed signing off. Hope you guys have a great day and good luck studying. Goodbye.